Welcome everybody to Native Strong, our Thursday 3 p.m. visit with Dr. Lyle Ignace from the Ignace Health Center, Indian Health Center here in Milwaukee, Wisconsin. And it's here that we talk about what's happening out in our communities around COVID-19 in some of the things that the subjects around that. So again, welcome. And as usual, each week I try to encourage those of you that are online with us to talk with your relatives and friends about the things you learn here today. Not a lot of programs out there where Native folks are talking to Native folks, and you're on one. What I want to do is hand this over to my friend Jeremiah. He's on your screen here, and he's going to walk you through a little housekeeping on how to participate in our plan going forward, and we're going to go right to Dr. Ignace. Thank you.
Thank you, Mark. And like you said, welcome back for those who have been recurring attendees here. This is our, I think, 4th or 5th. And like Mark said, so as we're going through here, whether you're a guest here on Zoom or via Facebook Live, we welcome questions, which we will then kind of get to afterwards in our Q&A. But if you go to your bottom of your screen on your Zoom interface, there is a little chat bubble. Open that up. I will send a little test message out very shortly, so look out for that. And you can enter questions in there as we go along, and we will get to them at the end. If you are watching via Facebook, please just comment on the video, and I will be watching that as well as we move along here. And again, welcome all. Thank you for taking the time with us today. And with that, I will introduce you and pass along to Dr. Lyle Ignace.
Thanks, Jeremiah. Thanks, Mark. Appreciate the words, and I want to welcome everyone back. This is actually our 5th week. Doesn't feel like it, but all the days are running into one another, and COVID is still with us. And so as I do customarily kind of review how things have been going over the last week, focus on a very broad and hone it in back to Wisconsin, and discuss what's going on in Indian country in the Bemidji area. So as you can see on this slide, worldwide, 6.4 million cases worldwide. That's a 13% increase since a week ago. The number of recovered is now bumped up to 2.3 million. That's an 18% increase since last week, and the number of fatalities is 382, 451 worldwide. Here in the United States, almost 1.9 million. It's about an 8.8% increase since last week, and we've also tested more than 18.2 million tests have been conducted in the United States. And I think when we look at the number of tests to the population, we're talking about a population in the United States of 325 million. So that's a fair amount of testing that's been ongoing. The number of recovered is 425,000, and the fatality in the United States is 108,551. Here in Wisconsin, from a week ago now, we've had a 17.8% increase. This is actually down from the week prior. It was actually 36% increase. So some moderate flattening going on. The number of recovered has increased to 12,624. And the number of fatalities is 616. So when I reference Indian country, I'm really talking about the Indian Health Service and the structure and the areas to kind of maneuver around and really identify the areas that I'm talking about. So when I talk about numbers, I talk about the areas that they represent. So Phoenix, I'll talk about Phoenix briefly. That represents Arizona, Utah, and Nevada whole collectively. Like Albuquerque involves New Mexico and Colorado. Billings involves Montana and Wyoming, the Great Plains, North Dakota, South Dakota, Nebraska, and Iowa. And then when I talk about Bemidji, I'm really talking about Minnesota, Wisconsin, Michigan. I am also referencing Illinois and Indiana, but predominantly the numbers that I'm seeing are coming out of the 3 states of Minnesota, Wisconsin, and Michigan. So when we talk about Indian country, I'm also referencing the 573 federally recognized tribes that receive care either from a federal site, a tribal health center, or a urban Indian health center. So this entire system throughout the entire United States services about 2.6 million of the 5.2 million self-identified American Indians and Alaska Natives in the country. So it's important to kind of get that context to know what population we're talking about. At the same time, we know that about 70% of the Native population reside in urban areas. So 30% of our population, Native population, still continue to live on reservations. 70% of that population reside in the urban setting. So it's important to keep that in mind. In addition, when I do talk about the Bemidji area office, the Bemidji area, I'm talking about the 34 recognized tribes, as well as the federal tribal sites, as well as the 4 urban Indian health programs that reside in these states as well. So that's Minneapolis, Gerald Ignace here in Milwaukee, Detroit, and Chicago, and their urban Indian health center as well. So looking at the numbers that have been posted by the Indian Health Service, they are looking at federal sites, tribal, and urban programs that report their results. In the area of Bemidji, where Wisconsin and the Ignace Indian Health Center reside, we are one of about 30 sites in the area that have been reporting our results. So this picture here representing of June 2nd, there's a day delay here in results, so it's not real time, but it's pretty close. So we see areas such as Alaska, Albuquerque, and all of the areas in IHS. One of the significant things that does pop out obviously is Navajo. They have documented 6,363 cases now. Phoenix has 1,920, and then you have Nashville and Albuquerque. Here in the Bemidji area, 248 cases. So when we look at the numbers, you can see positive, the totals on the bottom, negative totals on the bottom, doesn't exactly equal up to 138. So the difference here are the tests that are actually currently pending. So there are results, positive, negative, and pending tests that are still outstanding that have yet to be analyzed yet. So on the bar graph on the right-hand side, you can see the looking at trends and differences over from a week ago today. You can see that of all of the areas, Albuquerque stands out, Great Plains stands out, Nashville stands out, Navajo, and Phoenix and Portland. These are pretty significant changes. And so the second column of tests, that's the number of testing that's been ongoing. And when we look at the percent change, so that is the change of today versus what was occurring a week ago, we can get a better sense. So at the bottom, the average is nearly 23% change. That's the average. But when you start looking at how this compares to other areas, so we see Billings with a 22% change. The Great Plains has a significant change of almost 69%, Nashville 28%, and Phoenix 35%, and Portland 33%. So these are above the average, and certainly is concerning in these areas over the last week of the amount of testing that is going on, but also the number of positive cases. When we look at the far right column, we look at the percent positive. So this is the number of positive cases to number of tests being done. We can see that Nashville and Navajo have very high rates, as well as Phoenix. And so this information allows you to hone in on not only the hotspot areas, but also the trend of testing and confirmation and the percent positive. So by no means are any of the areas not seeing cases. They are across the board, across the United States. You know, Alaska has very few cases, which is great. The state is a bit isolated, of course, but they still have coronavirus still transmitting through their community. So it's really important to look at the numbers as a whole and look at the trends of how things have been transpiring. And it's important to know certainly what's going on in your area. So looking at it from the Bemidji area as a whole, if we look at the state of Michigan on the right, they have 55, nearly 56,000 cases now. That's a 3.8% increase from the week prior. In parentheses is the number, the difference between last week and now, so 2,100 new cases. Down on the right, Indiana, they're at nearly 36,000. That's a 12.6% increase from a week ago. They've had nearly 4,000 new cases since. Illinois, almost at 123,000. They've had a 7.5% increase from a week prior, and almost 8,600 new cases since last week. In Minnesota, 25,870. They've had a 15.2% increase in the number of cases, a little over 3,400 new cases. And when we get to Wisconsin, 19,400. That's almost 3,000 new cases from a week ago, and they have had a 17.8% increase. I think when we start looking at numbers collectively, if you look at Illinois in comparison to every other state here, you can pretty much combine Michigan, Minnesota, Wisconsin, Indiana. Combined total equals the number of cases in Illinois as a comparison. So, looking at numbers, looking at percents, looking at increases, everything needs to be kept in perspective. And of the 5 states here, Wisconsin certainly has the lowest number comparative to all the other states. So while the numbers are low, we're all at risk of being impacted by coronavirus. So it's certainly nothing to dismiss at all. So if we look at states and look at state tribes, here is Michigan and all of the tribes. I've reviewed the tribal websites and any documented cases that are publicly acknowledged. And I'm not seeing any reported case from these respective tribes. Now, that's certainly not to say there is none, because they have not publicly made announcements. But a good default would be looking at the county numbers that the tribes reside in. So when we look at let's say Bay Mills, In the northern part, Michigan and Chippewa, they've had 2 cases in their county. Same with Sault Ste. Marie, 2 cases that also are in Chippewa. And so when we look at the numbers in the county, although they have had no new cases in the last week, which is pretty amazing. And when you start looking at all of the counties that tribes reside in, you could see that there's a pretty good amount of 0 cases that are ongoing in these counties, which is remarkable, which is great, and a testament to these respective tribes in assuring their health and safety of their tribal members. However, once we start getting into more of the central Michigan and the southwest corner, we start to see different numbers, higher numbers, of course. So in Isabella and Saginaw, we see 78 cases in that county. That's not to say that that is Saginaw's tribal numbers. That's just the county numbers. And they've had 4 new cases from a week ago. The Potawatomi in Cass Lake, they've had 84 cases. That's 5 new cases. In Kalamazoo, obviously a bigger area, more densely populated, they've had 36 new cases. Now, one of the things with the Michigan Public Health Department website, although they don't give exact numbers, absolute numbers, and they certainly don't reference tribes by numbers, the native population is nearly 60,000. They are reporting out less than 1% of cases are native related. We just don't know which tribes, if any, actually do have cases. Going to Minnesota, we see, Red Lake, White Earth, Leech, a lot of the Chippewa tribes, and as we go down, each county as a reference to respective tribes, they've all have seen increases in cases. Not a lot. The one that does stick out is Shakopee outside of Minneapolis. That is in Scott County. Again, that's a more of a more populated area. Now, they have 455 cases, 76 new cases from a week ago, but again, those numbers are actually going down. So you'll see in parentheses, that is the number of new cases from a week ago. The letter next to it actually signifies a decrease or an increase. So you can see in Fond du Lac tribe, the Carleton, St. Louis counties, their numbers have gone down. In the more southern half of the state, their numbers have relatively stayed mild. Mill Lake has overlapped several counties, and so they have a reported number of 176. That's 10 new cases from the week prior, and that's a modest increase in their numbers there. In terms of total population of Minnesota, there's over 75,000 American Indians and Alaska Natives, and their Minnesota Department of Public Health has actually listed out 208 cases. That's 32 new cases from a week ago, and that's nearly a 19% increase since then. So numbers are continuing to incrementally increase, and that's the same as we see here in Wisconsin. So Stockbridge, Menominee, Oneida, Chippewa, Lac du Flambeau, Lecoutere, Winnebago, Bad River, and Red Cliff. Since a week ago, there's been no new public documented cases. That's not to say that they're not, they just have not publicly published them. So when we start looking at counties as a default reference point, we know that, let's say Menominee, in Menominee County, there are three cases in that county. Menominee has announced that they've had 2 cases on the reservation. We know that in Oneida, as of a week ago, they've had 39 cases. to this point. In Ho-Chunk, they have 13 documented cases. But as you go down into the counties, their incremental increases are, they're marginal. There's not a whole lot of new cases that are actively going on. So I think it's important to keep everything in perspective. In Wisconsin's Department of Health Services website that report all documented cases, in Wisconsin, there's actually 212 self-identified natives who have COVID cases. That's 26 new cases, 14% increase from a week ago. So still absolutely present. While they may not be on reservations, they are being documented throughout the state. So we need to look at not only the numbers that are on reservations, but off reservations, and this may be dealing with more of the urban city testing locations that are going on that are reporting out native cases. So now I wanted to introduce this and introduce Illinois. I did mention the number of cases. I've updated this. They have in Illinois 128,000 cases. So on the right-hand side, we have McHenry and Lake counties. Those are the two upper right-hand counties that are adjacent to Wisconsin. They both have significant numbers: 1,600 in McHenry, 8,500 in Lake County. Cook County is the county just below Lake, 33,000 cases. In Chicago alone, almost 47,000. And so when you start looking at the concentration of cases, the majority of cases are in these four counties. And then you have numbers and straggling out for the rest of the state. But I wanted to direct your attention because even though there are no federally recognized tribes in Illinois, Chicago does have an urban Indian health center. So there is a health center in Chicago that helps address the health needs of natives. And the state of Illinois' Department of Public Health website has listed out 193 cases in Illinois. What's important here is that their website actually delineates not only cases, but age groups. So when you start looking at the graph here, if we go left to right, ignore the 10 number there, that is not natives, but that top number where it says 8, that is the number of native cases that are less than 20 years old that are native. So there are 8 native cases less than 20. So every number on the top of each one of these spikes is the number of native cases. So you can see 26 in the 20 age group, 26 in the 30, 31 in the 40, and so on and so on. But it's just this, if we're looking at numbers, Illinois has probably the better of display of information when it comes to natives, certainly when it comes to demographics and to age. So I'm trying to expand and get as much information broadly as possible, and looking at every possible source in the Bemidji area to let you know what's going on in Indian country here. So again, 193, it's very consistent with what is going on in Wisconsin and consistent with what's going on in Minnesota. Bringing it back here to Wisconsin, as I mentioned, the number of cases just here in Wisconsin alone is 212. Last week was 186, so 26 new cases, 14%. There have been no new fatalities from a week ago, which is good. And so, but there are a total of 9 overall. So just to give you an update on what's going on in Wisconsin. Bringing it back to Milwaukee, over 8,000 cases have been confirmed, 286 fatalities. I introduced these two other graphs. So the number on the left-hand side, the graph where it says confirmed case count by age group. So when we start looking at where this is compared to what was going on even 3 months ago, we're talking about a bell-shaped curve that was really skewed to the right. And what I mean by that was the number of cases that we were seeing in the very beginning was of the much older age group. So we're talking about 60, 70, 80 age group had the predominant numbers. But as time has gone by, we're starting to see that the tip of the bell-shaped curve starts skewing more to the left, which tells me that the dynamics of cases are now shifting from the elder group to more of the younger age group. And so now we're talking about groups like 20, 30, 40, 50 age groups. The numbers are increasing by leaps and bounds. So the silver lining in this is that when you start looking at the graph on the right-hand side, the total deaths by age group. So again, in the beginning, we were seeing more of the cases of fatalities in that older age group, in that 60, 70, 80, 90 age group. And so with time, this really hasn't changed. So when we look at younger age groups, so the 20, 30, 40, 50 age groups, the numbers are much, much smaller. And so that's important to keep in mind. So when we hear about new cases that are going on, new cases in the state, either here in Wisconsin or Michigan or Minnesota or Bemidji, we really have to look at, you know, what's the age group, what's the demographics of these cases. Because if we're seeing the trend being more younger, the silver lining is we know that younger people do much better and handle overcoming COVID than older individuals who have more chronic conditions, where your concern of poor outcomes becomes much greater. So it's important to keep that in mind. Over the last 7 days here in Milwaukee, we can see, you know, the number of cases everywhere. Everyone's being tested. We can see the circles, yellow circles here, signifying the I guess the number. Smaller the circle, the smaller the cases. The bigger circles, more of the cases. So you can see the majority of new cases are coming out of the south side. And zip codes like 35215, 204, 205, yeah, so 204, 205. These are the majority of the cases by zip code that are occurring here in Milwaukee. So our clinic that is on the south side is, you could say, is smack dab in the middle of all of this activity that's going on the south side. When we look at racial ethnic breakdowns, we can see with the graph in Milwaukee County that the number of Native cases represents 0.4%. That hasn't changed, which is good. What has changed over the last month is the number of Hispanic and Latino cases. And that would coincide with what we're seeing, you know, from the previous graph with all of the activity that's going on the south side. The number of cases obviously is going up as well. And so they far exceeded all other demographics. When you start looking at where is the count for their Native population, we see on the far right side in the number of 26. So 26 cases, that's one, at least one new case as of this week that I'm familiar with. So the numbers are incrementally increasing. They pale in comparison to other racial groups, but we're talking about natives, and every native is important. So we need to keep that in perspective as well. So just a reminder of who's at risk. We know who's at risk. We know individuals that are over the age of 65 and older. We know nursing homes and long-term care facilities are super at risk. Reports are coming out right now where nearly 40% of all fatalities in the United States are individuals that were residents of nursing homes or long-term care facilities. This certainly makes sense in what's going on. We are dealing with older individuals that may not have the physical capabilities to overcome this infection. They're dealing with more chronic conditions, and they're, you know, as a resident, you may be of a nursing home, you may be one of 50 or 60 or 300 individuals in the same very compact facility. So the risk of transmission goes up dramatically. So we know that people with chronic lung conditions, COPD, who may be on oxygen, moderate to severe asthma, patients that are uncontrolled, severe heart conditions, individuals that may be dealing with cancer or cancer treatment. We know that morbid obesity is a risk, diabetes, kidney problems, liver problems, all are at risk. Even conditions for people who have autoimmune disease, such as rheumatoid arthritis, maybe lupus, or poorly controlled HIV or AIDS individuals, and people who are on immunosuppressive drugs like steroids, like prednisone. All these individuals are at risk, and so it's important to keep in mind who's at risk and who we should be protecting with the highest attention and vigilance over. Obviously, one of the biggest public health approaches is to assure washing your hands. That hasn't changed, and this is really just trying to show if you were to go through each one of these steps and just kind of look at it and washing your hands 20 seconds, keeping your hands as clean as possible. If you don't have soap and water, use hand sanitizer, and obviously avoid touching your eyes, nose, or mouth as being the most one of the biggest things that you need to avoid doing. Obviously, people wearing masks, usually customary in the public space, in a public forum to wear masks at this time. So both of those will certainly limit your risk of transmission and getting COVID. Here at Glick, we have, in partnership with the Radisson Hotel and Conference Center out of Green Bay, they've generously provided us with either soap and other personal hygiene items. We have kits. If you need kits, certainly call us. We can certainly offer that. We have cleaning kits that offer laundry and laundry detergent, bleach, bars of soap, as well as hand soap to help keep your house clean and disinfecting. We also have our YEP program, our Youth Empowerment Program. You know, the COVID, relatively stay-at-home effect is going to be long-lasting, and it's going to cover the summer months. And so I know our Youth Empowerment Group and our coordinators are looking at how we can support our Native youth, especially this summer. So stay tuned to any announcements that may come out on our newsletter about what's upcoming in our program. Circles of Strength. This is our domestic violence and sexual assault program. Given the stressors and issues of not only domestic and sexual assault, but also concerns about aorta, alcohol and substance abuse issues, or depression. These are all real issues, as in terms of health disparities. Natives certainly have higher incidences of depression in this time, certainly with the emotional aspects of what's going on, either, even financially, domestic, we have not only the staff, but the capability to address, and if you need assessments or evaluations or just help, please feel free to call us, and we will certainly get you connected with our behavioral health staff to help you. We have testing at our facility, and I think it's important to know here at our health center, we treat more than 75 different tribes, not just in the Bemidji area, but over 75 different tribes that people are part of here that reside in Milwaukee. So we're not just of Bemidji, we treat a lot of people from all different parts of the country. But to have a health center, patient-centered medical home that it can help address your health issues, we have that capability of testing. So if you do have any signs or symptoms of fever, cough, short of breath, headaches, fatigue, nausea, diarrhea, loss of smell, loss of taste, call this number, 414-383-9526. It'll prompt you to go through a few steps to be assessed for not only your symptoms, but also a date and time for your testing. So we have that test ability and capacity, and we're in negotiations right now to get an Abbott analyzer. And so we'll be able to test people in short order and get results within 20 minutes. So not only will we have the capacity, but we'll also be able to meet that demand and your need to assure you and your family are safe. This is our staff. Our staff, they're out there every day. In some of those early days, it was kind of cold being outside. Now it's starting to warm up. You can imagine how hot they can get, certainly if they're in all their gear, all their PPE gear. And so they're dedicated, and they're there to help assist and assess and test people when they need it. So we're here to help keep Milwaukee and all natives as safe as possible. So let me turn it back over to Jeremiah and Mark, and thank you for listening.
Afternoon, everybody, and welcome back to this section where we're going to start asking questions. Our last session, we ended with a couple open questions, and that had to do with moms and their children. For example, I believe one of the questions was, can a mother pass COVID-19 to their unborn child? Mm-hmm. Or I would believe included in that question is, what precautions should a mom what happens when a mom is COVID-19 and has a newborn baby? What does healthcare look like at that point?
So the CDC has come out, and it's certainly early on, but the thinking right now is that during pregnancy, the risk of transmission is minimal to none. There's been no documented cases of COVID being transferred from mother to baby, but that is during pregnancy. When you start talking about transmission of COVID, now we're talking about exposure to a newborn. And so that risk is just as real as anybody else. So if a mother is COVID positive and delivers, and the newborn is at risk for transmission, because now it is aerosolized and people and newborns can breathe that, their risk is just as real as anybody else's. So that is after delivery. Before delivery, while baby's still in mom, that has not been proven to COVID has not been proven to be transmitted while baby is still with mom. Now, if the concern, even like with breastfeeding, if mom is COVID positive, obviously a mask. We know that breastfeeding reduces risk, reduces infections in newborns, and so I certainly would insist that should continue as part of these early days, but it shouldn't prohibit anybody from having to do it. There are precautions that will need to be taken if mom is COVID positive, and that's really about, hand cleanliness as well as mask while feeding. So a few caveats there, but no, it has not been known or shown to be transmitted while mom is
I was wondering if you mentioned about having testing at the health center, and if you could just walk us through what a visit to the health center looks like. An example would be maybe someone hasn't been there except for their annual checkup, or even in the company of someone else, and now they want to get tested. What they pull into your parking lot, and then what exactly is going to happen? What does that process look like so people are comfortable and feeling good about what they're going to be walking into and experience once they kind of drive into that driveway and are heading towards your doorway?
So to kind of set this up, if you feel like you or one of your family members has any of the signs or symptoms of COVID, we actually insist that you just don't show up. We want you to call us ahead of time. That way we are prepared to accept anybody that may come in specifically around testing. So this phone number, 414-383-9526, call. We will take your call. We will ask you several questions about signs and symptoms and household, and we will set up a time to show up and to be tested. Once we get that call and we set up a time, that we can at least notify our frontline people who actually do the test, where they can get gowned up, have all the protective equipment on. And so your appointment time will be set up. You will arrive by your vehicle. We have a canopy that you can pull up in, and we will come out to you, and we will also do another assessment when you show up. We'll take your temperature, and we will test you right there in the car. Now, the tests that we do are the nasal swabs, and these swabs, while we don't have the immediate test to tell you right now, these tests do get collected and do get sent out at the end of the day, and we've been getting our results back within 24 hours. So I know it's uncomfortable to get a nasal swab. It certainly doesn't tickle, but it doesn't hurt either. It's just an uncomfortable sensation. But we do it. We do it in the car. You don't have to get out of your car. And depending if it's just you or you want other family members to be tested, we can do that all on the spot. And once you're done, we will tell you to stay at home, kind of self-quarantine, isolate yourself until you get the results back. And once your results come back, if they're negative, you kind of have a clean slate to go about your day-to-day. If you or any of your other individuals that get tested that day come back positive, we will instruct you and educate you on what you should be doing next. Whether it's following symptoms, establishing your connection with a doctor by telehealth, and staying connected. We will be telling, we have contact tracers, so we will have a follow-up call with you, and we will start going through kind of this investigative approach as to how you may have come to get the virus. And we start working through what has been going on, where you've been, who you've been exposed to, or who may have been exposed to you over this time period. So do expect a follow-up if your test comes back positive. So that's kind of the process. It's not just about testing. We do follow-up, we do education, we talk about prevention and establishing care with a primary doctor.
When you talk about contact tracer,
yeah,
does that mean that, let's say someone comes in and they're going to be kind of, I guess, lack of a better word, investigated contact tracer? Does that mean somebody's going to be going through my phone or going through computer data? What exactly does that mean?
No, we're not. Nothing like that. Nothing like that at all. But it does involve, a discussion about your contacts. So obviously, if you live by yourself, you haven't gone anywhere other than to a store, it's going to be pretty hard to kind of determine where and when you may have been exposed to this. But if you are someone who has the coronavirus and you have a household of 4 or 5 people, everyone's been kind of going about their business, but it's mainly having a discussion of who you may have been in contact with, whether it be in the household or maybe you've been traveling, you've been going around town, you've been going visiting people, so it's important to not only look at the individual, but also look at where they've been. And if they've been having symptoms over the time of, let's say they've been interacting with other gatherings or other meetings or other homes, that home may be at risk for not only being exposed, but also having the virus transmitted into that household. So it really now becomes kind of a public health approach to looking at individuals, looking at who they normally associate with. It's not about getting into private, we're not talking about social security numbers or anything like that, or doing any sampling of testing unless the person wants to be tested. But it's not that intrusive. It's mainly about, hey, were you with Joe or Mary last week? Okay, are they in your house, or is that somewhere that you've been going, visiting? Is that another family relative? I mean, so it's really about trying to find who may be at risk, looking at educating, preventing, and really helping families minimize their risk of spreading within.
Now that families are, the heads of families and the support crew for those families are headed back to work, one of our Native families had a question about, after being back at work for a couple days, they're with coworkers who believe that COVID-19 is really nothing to worry about, and they don't wear masks, they're not washing hands, they're using the lunch area just in and out like nothing's happened.
Yeah.
The supervisor also shared with the worker that, hey, don't worry about your workstation. Our janitorial staff comes through each evening and cleans your area. So when you come back, you can be assured that your desk and other things are good, and you can just get right to work.
Mm-hmm.
Kind of hearing that, just if you would give some of your reactions as a doctor and someone who knows about virus and surfaces and how someone should go about conducting themselves now that they're kind of in that 3rd, 4th day of being back at work with this kind of atmosphere and attitude.
So I think it's important that every employer at least gives the reassurance to their staff, their employees, the reassurance that not only are they have their health and safety of interest and at heart, but what are they actually doing to help minimize and reduce their risk. So I think it's important that policies, if as an employee going back to work, I think it's fair game to ask their employer what are the policies and procedures now for COVID-19 in the workplace. I think that's important, and I think every employee whether it's a nonprofit, whether it's a private organization, whether it's 2 people or 2,000. I think it's important to know what your workplace policies and procedures are for your safety at work. And so that's certainly one thing. I think if you personally want to wear a mask, I think you should feel absolutely free and be able to do that without interference or ridicule. There's no shame in wearing masks, and I think it's important that if that's what makes you feel at ease and a level of safety that you're comfortable with, I think it's important that you do that for yourself without question. It would be nice if employers offered that face mask to their employees. I know it is expensive, but it's not mandatory that employers provide that to employees. In terms of workstation, and I think this is extremely important. So if you know you're going to be in a cubicle or space or kind of a group spacing of other employees, I think it's important to know that you can't assume that your workstation has been cleaned, sanitized, at least to your level of leaking. That may require you to bring your own items to work. Now, the workplace may provide a kind of a cleaning disinfectant of your workstation, but I think unless you're there for when it happens and seen it happen, I think you have to assume that it had not been cleaned. And so I think it's incumbent upon you at your workstation that you know you'll be there for long periods of time to clean yourself in addition. And so that means your keyboard, that means your counter space that you'll be working on, that includes the phone. If you use a headset, that's fine. Make sure all of the hard surfaces of your headset or your phone are clean. Even the numbers on your phone need to be wiped down. And so it's important to have that. If you have hand sanitizer that you like using, bring it to work. There's no harm in using it whenever you feel uncomfortable or feel like you need to have that level of clean about you. Just bring this hand sanitizer with you. Wash your hands as often as you can at work. So that's going to be important as well. And don't touch your eyes, nose, mouth.
Just as we're sitting here in Milwaukee, a lot of us just received a text coming, I think it was out of the county, as you were speaking about bus services being suspended later this evening. I think that's in anticipation of more gatherings of folks out in the streets. So let's say I'm a parent in my child's, or the folks, some of the folks living in my house are activists. They want to be out there in that crowd. They want to be a part of it. I don't think anybody's in the business of policing adult children or folks that want to participate in the cause of justice, but certainly there's a cause of health too. Mm-hmm. And if that young person or even that older person is going out into those crowds, what advice would you give to them if they want to become a part of these peaceful demonstrations that are happening in our city?
Yeah, so I think there needs to be a level of personal accountability to yourself. And so I think being involved and being active and being part of these gatherings or in being part of what's going on, I think it's important that you provide a level of protection for yourself. So if that is wearing a mask, we know social distancing helps. We know masks help. We also know washing hands either with soap or hand sanitizer, not touching your eyes, nose, mouth. So keeping that all in mind, that's what you're going to be out in the public in these small areas. I think it's important that you maintain that level of protection. It's not to say you can't, just be aware that there needs to be a heightened level of protection that you need to offer yourself. Because we're also talking about the other people that may be with you in that area So that's certainly one level of self accountability. The other concerns, and is we're not really going to know what the impact of what's been going on the last week when it comes to coronavirus. We know that there is a delay between not only transmission, but also signs and symptoms. So people may be out and about in this time frame, but if they were to get COVID, they may not show any signs or symptoms until next week or even up to 10 days from today, let's say. So that's if you're self-conscious about coronavirus, and let's say you are part of a bigger family residing in the same household with aunts and uncles, grandma, with your parents or grandparents who you know of older age or at high risk, there really needs to be a level of that protection that you need to carry with you, not only in public, but I think if in returning back to your residence, and this is a routine that I have customarily gotten used to, I may be at work, and the clothes that I wear at work is not the same that I wear when I get home. What I mean by that is I wear clothes for work. When I get home, I put those aside, do my personal, shower, and I get into new clothes. And so, not to say people can't be out; they certainly can. But I think upon returning, they need to go through that process of, hey, I've been out. This is what I was wearing. They need to be set aside for wash and do a shower, soap, water, and new set of clothes when you get home. That would be the best I could suggest. That would help protect you not only in public, but also protect people when you get home.
Just a follow-up question to that one. After that person's home and they've washed, they got that new set of clothes, and now they're settling in, there might be 2 or 3 people. So what I hear you saying is every person that's coming in from outside should be doing this, just not the person who's like the main caregiver of the house, but we're talking about children. We're talking about a casual, are we talking about a casual errand where someone goes to the store and, hey, we have an ability to get a week's worth of groceries, and oh, I forgot this one thing. So that person just goes out for that one thing and comes back. That process you're talking about is something you're wanting to see them enter into. Is that correct?
Yeah, I think it really will depend. I mean, if you're out, let's say you're running errands all day, I think you got to get into that mindset that what I'm wearing now, I need to be out and do all of these. So if I am out, I'm not having to go home and say, oh, I forgot ketchup. Or I forgot the hot dogs. Hot dogs was a bad example, but I forgot something for dinner that night, and I have to go back. Well, believe me, it's happened to all of us, and so it may be nice to find a way of communicating to home, whether or not, hey, I'm still out. Do you need anything while I'm out? Because once I'm home, I know I'm going to be home for the rest of the night, and I don't want to have to take another shower to go out and make another run. So I think it's just a level of communication amongst family in a house. But if you know you're going to, let's say I have to go to the hardware store, and I know I'm going to be there, and you get in there and there are 100 people in there, I think it's pretty safe to assume that whatever you're wearing, you need to go through the same process again.
It is graduation time. Certainly the last few weeks, and then this upcoming week for sure, and definitely the week following for the later graduates. A lot of our Native community is going to be heading to reservations, to other cities to visit grandmas and grandpas, aunts and uncles for celebrations of one sort or another. And it's like we have this idea that, well, that's our family and we trust them.
Mm.
And so we just kind of go into that house and go into that party and conduct ourselves like nothing's going on. I think you had a philosophy about that kind of thing, and that was assume that the person you're interacting with has it. Are you still there with that thought? Is that still a good way to go for us?
Well, I think it's important to be hyper vigilant, and be. I think the last thing anybody wants to do is feel like they're the one that may have transmitted a virus into a household, even if it is family. So I know graduations are coming, family get-togethers. It's summertime, it's barbecue time, it's hanging out time, being outside. So again, this kind of goes back to the personal accountability to self and how you're going to protect yourself, because if you know you're going to be in a family gathering, I think it's important that maybe that's the goal and what you have to do, and prepare yourself in anticipation of that day when that occurs. And that day may occur with, maybe it does mean you have to wear a mask. Maybe you have to wear it more than often. It's not to say you can't interact and gather and hang out and have a good time. But certainly, absolutely do it. But I think it's important that we find ways to limit and minimize transmitting. Even if you think that family members, hey, they're good, then no symptoms, everything's been fine, no problems, that it's okay. Well, that may be true probably most of the time, but I think it's pretty safe. I think it's safe to assume, and we've seen reports of this all the time, and there were early reports when this was coming out that, let's say in Chicago, an individual who had maybe mild symptoms, maybe just a cough, really mild fever, nothing to say, hey, I got coronavirus, but not knowing how contagious this was at the time. This was an individual that had visited, that had come back and had to attend a funeral. Obviously, there's people. And while this individual was visiting funeral, and family and relatives also attended a barbecue that weekend as well. So without thinking that he was an individual that was not only sick, but would spread infection, coronavirus, that one person ended up infecting 16 people. These 16 people then became positive for the coronavirus. So it's a real situation, and it does occur, and it does occur even amongst families, and that's probably how virus is being transmitted right now. Whereas before, we really didn't know where it was coming from. We knew it came from overseas. We knew that it was happening in communities, community spread. We didn't know how and how contagious the transmission was. And now that we've learned more about what needs to be done to not only minimize and reduce risk, I think it's important that we have to maintain a level of protection amongst even our family members.
Some of our folks in our traditional communities, their ceremonies of late spring and early summer are starting up, and I know there's been some discussions about whether they should start up or not. We have seen information, just as you've talked about, is the idea of spreading coronavirus contact in the community. We've kind of discussed what some of those terms are, but there's also a term that's out there called super spreader. You know, it's quite something, but I know there's actually science behind some of these terms that we as lay people and not scientists or medical folks understand what that is. But can you talk about what a super spreader is, and maybe those folks who are leading some of these ceremonies are in here and can learn something from what exactly that situation looks like and what's involved?
Sure. So the example I just gave about the individual who had visited for a funeral and for a family barbecue, that would be defined as a super spreader, someone who wasn't overly infectious, with signs or symptoms, but wasn't asymptomatic. So, but it was someone who introduced themselves to a gathering or a group and then ended up infecting everyone. And as contagious as this virus is, everyone that came in direct contact not only became exposed, but also transmitted and became infected. That's very similar to what occurred in Navajo, on the Navajo reservation. There was a rural gathering, a religious gathering, an event that was going on. A lot of people attended. Someone there was positive for the coronavirus, ended up being that super spreader, and multiple people from that event then became positive. So I'm not saying that's how all of Navajo occurred, but when you have clusters, you can get clusters just from these gatherings and events alone. So all of these sporting events, and I just read this morning that in Milwaukee Summerfest, they've canceled everything. And even in the Pfizer Forum, even Pfaff Theater, the orchestras, everything where people come together to, partake in the event, they've canceled everything. The state fair's been canceled. County fairs are probably going to be all canceled. So everyone is following suit. Major League Sports are all following suit in this regard. And everyone's trying to figure out how they can reconvene in everything that we've done before COVID. And it's just getting harder and harder to find that path. So we know it happens. We know there are super spreaders. These are really people that are contagious, that may be symptomatic or mild symptoms. And I mean mild. I mean maybe a sneeze or a cough every once in a while, no big deal. No fevers, or even a low-grade fever, then they don't feel bad, or they're completely asymptomatic and they're going spot to spot to spot, and then all these areas now become positive. So those are just some real, quick examples of not only gatherings and meetings, but also how super spreaders can be focal points for spreading the infection.
I know that a lot of our folks visit our elderly in homes, and we're speaking to them through windows.
Mm-hmm.
Some of those windows are shut, and we're talking to them with our phones.
Yeah.
Other ones, from the inside, a person can open that window quite easily and get a gift. They can exchange, maybe someone needs a lesson on how to use the iPad that they got them so they can be closer to their loved one. Is that a place, even with the window kind of partially shut, can those gifts be a danger for COVID-19? And if that person opens that window, is there something they can do, or is that just kind of fine? I've seen it happen.
Yeah.
So that's the question. We want Grandpa to have this thing, and he meets him at the window. One place they couldn't. It was another person, another place they could, because those windows came open, and it was just like nothing to go back and forth. What would you say to that kind of thing? What's going on there?
So I wouldn't be opposed to doing that, but I think there would need to be that face-to-face encounter. Protect yourself, protect your elder that you're giving a gift, but even the gift may need to be wiped down and cleaned before giving it to who you intended to. So I think that could be a safe exchange. But I think there needs to be an understanding that, hey, I need to, and maybe, hey, grandma, grandpa, they need to have a mask even during this short encounter, and that whatever is being passed over, that should be cleaned as best as possible in doing that.
So one of the other questions we had kind of in between our visits was this question about where is this all going? I know you kind of addressed this towards the end of each of our talks, but the idea is people are looking at their summer. Mm-hmm. They're looking at expanding their contact exposure to so many new people by going back to work. And now with the protests, it could very well be in that time frame of that 5.5 days that you were talking about from, let's say it's today. That then we're looking at Monday, Tuesday, where people start kind of either showing symptoms or not showing symptoms as COVID-19 spread in some of the protests that we're seeing. And then certainly 10 days afterwards, there's going to be a real spike in kind of maybe what's your fears or what signs of encouragement could you give us, just as someone in your position, medical field, kind of looking at this from a mile high perspective?
Sure. So I think from a public health standpoint, everything that has been sent out or even could be conceivably adopted has been done already. So, that's the, stay at home, self-isolation, limit exposure, minimize risk, protective equipment, masks, hand sanitizer, soap, all these norms that we've had to adopt, that's been well established, and everyone should have a new normal in that regard. With all of everything that is going on. So, we won't know for sure what the impact, even opening Wisconsin's businesses, the state, we have Memorial Day weekend, people were moving about the state, they're moving, interacting, having a good time. And so we're not quite out of that time frame of knowing what the impact of even that weekend alone will show us. And so we're close to that. I think maybe by Monday, we'll have a better sense of what overall impact of opening up just society in general, especially that holiday weekend. Okay. The new variable that has come in that has kind of changed the dynamic here is obviously with the George Floyd situation, and all of the protests have come as a result of that. You have major cities, major groupings, major gatherings, major marches and protests. We won't know the impact of that either, and it's going to be at least 10 to 14 days from, let's say, even today. We'll look 10 days out from now, 14 days out, what is the impact of what has been going on the last week when it comes as it relates to coronavirus? It's going to be that type of delay. I've been asked, what is this? Where is this all going? What is this all looking like? Well, we know right now that just the opening of our communities and the protests and gatherings that have been ongoing, there's going to be this whole block of time, and it's going to be about 4 to 6 weeks to really know where this is all going to go. I think there are 3 things that I think will change how we collectively as a society, as United States, as we move forward. 3 things. One is a vaccine, and when that will be developed, and when will that be distributed for people to receive the vaccine? That's one. The second is developing a treatment therapy. Let's say, people may have, let's say they have a headache. They want to take a Tylenol, Ibuprofen, or Aspirin. Hey, and my headache goes away, great. We're talking about that type of treatment modality, a medication that you can take. If you get coronavirus, you can get this, and it will help reduce your symptoms and get you over. It won't prevent you from getting it, but it'll help your signs and symptoms and help you get over this. Just like people have sinusitis, they take an antibiotic and it goes away, that type of treatment. So vaccine, a treatment modality. And the third one that is talking about the virus itself. What happens with the virus? Are we going to get a second wave? Are we going to get a small wave, no wave? And it's quite possible the virus could burn itself out before the winter months come. So it really will depend on these three things. We can't, life needs to move on, and we are living as we can right now under the circumstances. But to have any major breakthrough, those three things need to occur. Not all together, but one of these things will occur. If the virus continues to be the way it is, well, we will have a vaccine. Or what will be an absolute game changer would be as if we find a treatment that helps reduce signs and symptoms and helps individuals overcome the coronavirus. If those were to occur, we can start talking about getting back to our normal way of life, like pre-COVID. It is certainly possible.
Dr. Ignace, some folks in at least in my circle, are elder folks, they've really stuck home and they've done really well. In fact, remarkably well. Because they're not out and about, because they've been concentrating on themselves, they're getting healthier, and they're actually, a lot of cases, doing better than before COVID-19 struck, because they have nothing really to look at except for if we're in that good position where they can take care of their physical health. And a lot of them are doing really well, because that self-care is what they've concentrated on. Now they're feeling better. And they're like, hey, I want to get out there. I feel good now. I want to get out there, do things that I used to do. So for older people especially, are there things or tips you can give them? One example would be, some stores offer times of the day when an older person can go shopping. And then there's less population in the store, or there are more items that are available to what they're doing. Are there other kind of social action things that are happening for our elderly folks that can, those vulnerable, that can help them, and they're wanting to get out and do something, but they want to do it in a healthful, fulfilling way? Might you suggest anything for those folks? Tips?
I think it's important, as you mentioned, Mark, that people who have stayed hunkered down, and we're talking about 14, 15 weeks now of hunkering down. That's a long period of time. Now, people may feel better, stronger, and at least more self-assured that maybe things are getting better, just in public, but also for themselves physically. People got to do what they have to do. So if the essentials are, store or items or food, groceries, absolutely do what you have to do. But if you're looking for things to do outside of that, there's certainly no problems being outside and enjoying the weather now. Either that's just being outside, enjoying the sun, enjoying the weather, or actually having the physical ability to go and walk. You know, walking has always been an essential part of who we have been, as part of, you know, just getting from one place to another, and just being out and enjoying your surroundings. Whether maybe it's doing yard work, maybe there's projects that you want to do that you haven't done outside of the house that need to get done. You know, maybe this is the time and focus to be able to do that. Just being physical, being active, will be good. And certainly being out in the sun and increasing your vitamin D will certainly be helpful as well.
So as a follow-up in being active, is the health center going to be doing a community gardening program this year? And how could someone get involved with that or learn more?
So yes, we have our community garden. We are it's up. It's being tended to even right now. We're actually looking for individuals that would help support the garden for the rest of the summer. So we are looking for help, assistance in any way. Feel free to call us or connect with us on our Facebook and ask if you want to help and volunteer. Or I know we've posted positions to help with our garden, so that's an ongoing process and that will never change. And if you're just wanting to get out and help, and volunteer your time to help us with our garden, absolutely, we'll take that. We'll take that help, and you know, whatever we can get in assistance would be great.
One of the last things I have right now is an announcement for the community that's listening. We've been working, I mean I, several other people, Dr. Ignace included, in recognizing the special challenges that are facing our community and often our invisibility. At this particular moment in time, Potawatomi, where they have trust land here in Milwaukee on the north side, especially poignant given all the things that are happening in our city. They've generously offered to host a community fire as a place of vigil. There's a lot of folks that really have missed ceremonies. There's a lot of folks that have people in hospitals for reasons other than COVID-19, haven't been able to see them. Gatherings have taken place all over windows, and folks that are hungry for our culture and expressions of our spirituality. We're going to have a place to go, and we're going to be able to do it safely. The Gerald L. Ignace Health Center is writing health protocols for the firekeepers of this fire. We'll be announcing that as soon as we get final word. I just want everybody to know that's hopefully will be happening setup time next Thursday, and we'll be fully vested in that program Friday, then through Monday. And we'll let you know where that's going to be. Right now, we on the campus, we know the area, but we're kind of wrestling with insurance people who don't understand what a fire is. Apparently, they thought it was going to be Burning Man. And they weren't sure. Their adjuster was that they wanted to have it. So we sent pictures of what one looked like. It's tough to find one of a ceremonial fire. So I just went to the YMCA and said it's about this size. So hopefully we'll have good news from them, and we will have good news in cooperation with the Ignace Health Center in giving our community a place to go with our traditions and our expressions of love and support for those that are negatively affected in this day and age by a lot of things that are facing us, social justice issues included. So with that, I'm going to turn this back over to Jeremiah and Dr. Ignace to close out our time together. We usually close this out about 4:30, and there were a lot of things we talked about and learned today for all of you that are online. And just a reminder, a lot of folks turn into this program after we're done, and they hop about electronically to get the things that they're looking to get. You are advocates, and you are the ones that have a privilege, as I do, to be a part of what happened today. And with that information, I hope that you do spread the word of health and how we can take care of ourselves and our family. And with that, I'll turn this over to Jeremiah and Dr. Ignace to conclude our session this week. Thank you.
Thank you so much, Mark. I did have one real quick question from an attendee on Facebook. Joanne had asked about whether or not, and I'm sure this is a wide-ranging question of, does Gerald Ignace have the ability to test for antibodies? She, specifically said to test to show whether you've had it or not. And I know that's probably a question, especially as things begin to open up, to test whether or not you're safe from it, and you have those antibodies.
So as a quick answer to that, we have in-house a phlebotomy company called Quest. Now we do not have the swabs here to test antibodies, but if we're looking to do antibody tests, we rely on Quest, and that would require a blood draw, and that gets sent out to be tested. So now we don't test. We have the capability to collect the blood sample and be sent out to be tested. That's the best I could do on that.
All right, thank you. And I guess one last thing, I know, a few hours ago, it was stated that Milwaukee will now kind of open itself up as far as bars and restaurants will be open as of tomorrow, I believe at 2 p.m. So maybe just some parting words as far as, if people are so inclined to be going out tomorrow and maybe this weekend for not only that, but also, as you have mentioned multiple times, for protests and the peaceful gatherings that have been happening, how to best prepare yourself and shield yourself the best you can.
Well, this just being announced, what I would first and foremost, we talked about personal responsibility and accountability to yourself. First and foremost, to assure that you have a level of protection for yourself, and certainly, what does that look like returning home? I think we've all been kind of in this new normal of what that may look like. With more openings and being more active out in the general community, I think it becomes even more critical that people look at that level of protection for themselves. So that's going to be important. So it's important, when we look at our Milwaukee community, or even in general, every community where you reside in, when we start looking at bars and restaurants, you really need to pay particular attention of your surroundings. And so, going to a bar or going to an establishment for food or sit down, I think it's important that if you don't feel comfortable, where you are, I think if it's just not comfortable a level for you, you don't have to be there. But I think if you do, or you want to be supportive in whatever fashion that may be, just assure that you have that protection about yourself, and just be cognizant of not only yourself, but when you do go home or back to your residence, what does that look like in terms of family members, and especially the elders at home. So again, protect yourself, protect your family, protect your elders. It is that important, especially now that that social distancing doesn't seem to be 6 feet anymore. It seems to be much coming in shoulder to shoulder now. So just should raise everyone's awareness just up a little bit more, to assure that you are minimizing your risk.
Dr. Ignace, that's our time. And to everyone that joined us, thank you for being with us. And as usual, we end our session together with just a word or two from Dr. Ignace. And thank you for being here. We look forward to you being with us next week with your questions. So Dr. Ignace, you have the floor.
So, we've had an ongoing session here, and it's important. It's important to hear from the community, and I think this is just an avenue, a platform to be able to do that. It's so important that when we talk about testing, people have symptoms. Coronavirus is going to be with us for a while. There's no doubt. It's not going to be over tomorrow, certainly not next week or next month. But it's important that, collectively as a community, Native community, whether it's here in Milwaukee, whether it's on reservations or any other city in the area or in the United States, when we start talking about protecting ourselves and protecting our Native lessons and our traditions, it's important that we really look at protecting our elders. They are the harbingers of information that long precedes us, of not only their stories, but their traditions and cultures and dialect and language and customs. We can't lose our elders. We can't lose it to this, not this way. So absolutely important that there is a level of accountability and self-protection, because you're not just looking at yourself, you're looking at your family and you're looking at your elders, and we want to protect them as much as we possibly can. So stay safe, be careful, and protect yourself as best you can. So stay strong.